So we're going to get started with our next talk. So it's my pleasure now to introduce Vivian Agneche, Tashika James, Taylor Kuramato, and Taylor Nelson. And they're going to be talking to us about an epidemiological model of bovine respiratory syncytial virus, BRSV, infection dynamics. Who's starting?
This work was done in collaboration with our mentors, Dr. Chen, Dr. Lanzas, and Dr. Lenhant. For this presentation, we're going to be talking about the background of Bovine Respiratory Syncytial Virus, BRSV. Then we're going to talk about our model formulation, the simulations we ran, the results, and the conclusion. Bovine Respiratory Syncytial Virus, BRSV, causes respiratory distress, which includes interstitial pneumonia, which is like the inflammation of the walls of the alveoli. It also causes like bleeding in the bronchi and the bronchioles. And it's, well, aside from this respiratory distress that it causes, it is one of the pathogens in the larger bovine respiratory disease complex, which is the leading cause of morbidity and mortality in cattle feedlot in the United States. It should be noted that studies have shown that BRSV is predominant in calves. About 70% of calves have been infected by 12 months of age. However, there is greater prevalence between the age of 2 to 5 months. Some factors that are responsible for this severity include like the level of the maternal antibodies, the virulence of the virus, the presence of another viral or bacterial infections in the case of BRD, the housing and management, and the weather conditions. If a cattle becomes like infected with BRSV, some of the symptoms that they show include mucus discharge from nose and eyes, high fever, cough, tachypnea and difficulty in breathing, reduced activity and anorexia. Primary infection is like the first exposure to a particular pathogen. For a calf to become infected, the virus is transmitted through aerosol or direct contact from an infected cattle. It should be noted that contact is really necessary for the transmission of this virus. However, infectious nasal secretions that could travel not more than 6 feet could still transmit the virus. Aside from primary infection, a cow can still become secondarily infected, and this occurs after they lose their disease-induced immunity. And it could come as a re-exposure to the virus, especially in the winter or autumn, but it can also come as a reactivation of a persistent virus, which occurs mostly in the summer. However, unlike in the primary infection, secondary infections don't really the clinical signs, like the clinical symptoms I mentioned before, are not really severe in secondary infections, but they are in primary infections. The prognosis of this disease include the incubation period. Incubation period is like the period between the exposure to a particular pathogen to the appearance of the first symptoms. For this virus, the incubation period is 2 to 5 days, after which the clinical signs set in and could last 7 to 10 days after infection. In this case, we say the infection is severe, and we say the cattle is like clinically infected. However, not all infected and contagious cattle show signs, and in this case, we say they are subclinically infected, which is like a mild form of the infection. Aside from the torture the cattle go through when they are infected with BRSV, the BRSV also takes a great financial toll on the farmers and the industry. This includes the cost stemming from debt, reduced performance, poor growth, and administration of vaccines and treatments. The ultimate goal of this project is to predict the spread of BRSV and to help farmers curb unnecessary costs. In order to do that, we'll be investigating the mechanisms that spark bovine respiratory enzootics with a mathematical model. We're going to research the effect of cattle population composition on the disease dynamics, like how does the infected, the maternally immune, the exposed all come to play in the dynamics of this disease in a particular feedlot, and we'll also examine the effect of cattle network on the transmission of the pathogen. This is the role sociality plays in a feedlot.
For our project, we use the agent-based model. The model has individual behavior, heterogeneity, complex interaction, and stochasticity. The reason why we use the agent-based model is because it takes into account detailed individual information and individual variation, example, susceptibility, infectiousness, behavior, etc. Our model also has heterogeneity in the contact network, and it allows for a more realistic description of the infections and the transmission processes. In our model, we generate data from a real-time location system. This system has two main components. I'm sorry. This system has two main components, sensors and tags. Tags have all the information of the calves, and the sensors, on this picture you can see where the sensors are located in these three sections, and then it decides whether the cow is between the X or Y coordinate. This picture shows how we define contact, and contact is defined when two animals are within 0.3 meters in a 10-second interval. From this data, we create our adjacency matrix data. Our network structure is based on a real-time location data that was created from Kansas State University. These are examples of contact. This one is contact between two cows, 1 foot. And this is the weighted network. And the weighted network is based off the real-time location data. And the thicker the links, the more intense the contact. The network density is the interaction between calves per day. As you can see right here, the contact fluctuates due to social interaction. These two high peaks are feeding time, so it's very high. And this one is in the evening when they have less interactions. In NetLogo, we create calves and create links between calves. The links were created to be one of 6 of the disease status, which are maternally immune, susceptible, exposed, and infected. The infected calf can be clinically infected or subclinically infected. The clinically infected calves are twice as infectious than the subclinically infected calf. Then they go to the recovered stage. We also created links between calves, and the links that were created was undirected links and direct effect links. The undirected links has a full contact network, and the directed effect links move calves from clinically infected to susceptible and subclinical to susceptible.
So Tashika talked about how the agents are created in our model, but these are the processes that move the agents through our model. So if you look at each step here, our model asks every individual in the model, and it's a conditional process. So if you are maternally immune, you will do the process that is lose maternal immunity if you fit the criteria. So each of these ranges of days are a normal distribution and puts 99.5% of the agents within that range. And those were found from some papers that we looked at. And so it goes through and we ask if it's maternally immune, and it will move from maternally immune to susceptible. And from susceptible, it will move to be infected. But once it's infected, it cannot transmit the virus right away. it will have an incubation period of 2 to 5 days. After that, it moves to where it can transmit the virus. And once it can transmit the virus, it only has a certain probability of transmitting the virus. And that is in the transmission function, which I'll talk about in a second. Once they are infected, they last in that infectious period between 7 and 14 days. And after that, they recover. Once you're recovered, you have passive immunity gained from having the virus. And that passive immunity lasts 90 to 120 days. And once you lose immunity, you can become infected again, but you can only become subclinically reinfected. But most of our simulations only ran for about 30 days, so this wasn't a factor. So in building the transmission is like the biggest part of our model. We use that input data that Tashika talked about from the Kansas State University. And so every cow was connected to the cows that it had contact with in each hour. And we used a matrix, this adjacency matrix, that had all 21 cows listed and all their contacts with the other 20 cows. And each of those had a weight. And those were weighted of like the intensity of contacts they had with each individual within that hour. So the transmission function is based on how many contacts you have with other infected cows. The more contacts you have, the greater probability of transmission of the disease. So every hour, it calculates a new probability of getting transmission, and you can only transmit between an infected individual to a susceptible individual. So here I have a demonstration kind of our model. This is the interface of our model, and we're going to kind of show a video of a couple simulations we ran and how it all works so you get a clearer idea. Will you press play? So here on the side, it's showing the different sliders we have where you can adjust the initial conditions of the model and how many individuals are in the model. You can only have up to 21 individuals in this model because that's the data we have. You can have less than that, but no more. Also, you have the time there you can set to any time. And then here on the sides, we have monitors that monitor the network density, the effective network density, and the infectious individuals. You can also adjust the time, how fast the model runs, and see how it runs. Right here, you can see the links. The thicker links are more contacts. The directed links with the arrows are from individuals that are infected to individuals that are not infected. Also, you can know I'm setting up again in the video, and once you set it up again, the model is stochastic, so it will get different results every time because of that probability of transmission. The disease does not always survive in the model. Sometimes it naturally dies out, and in this next simulation you can see that you will see the infectious individuals. There are some, but eventually there will be none. So now we're going to talk about the simulations we ran and how we used our model.
We were using our model. We ran 4 simulation cases under differing conditions to see the disease dynamics. So we considered the first 2 simulations considered when the initially infected individual is either the most or least connected. And we determined the most or least connected to be the cumulative number of contacts that a cow has in the contact network data matrices that we got from Kansas State. The second set of simulation cases that we looked at were differing network structures, and this was under a heterogeneous network or a homogeneous network. The heterogeneous network is the same network that we use for the most and least connected, only we're not concerned with specifically making the initially infected individual a cow with a specific connectivity. The homogeneous network was different from the heterogeneous network because we designed it so that each cow has the weight of the link is the same weight between each cow. So we took the cumulative number of contacts in each matrice and averaged that. And then we took those averages and averaged them over all 24 matrices, and that value, about 11.85, is then assigned to every single link to every cow in the network. So we have these 4 cases, and under those 4 cases, we ran 9 different scenarios where we split the the infectious numbers by 1 and 20. And we ran those in large batches of 100 runs so that we could average those. And in each run, there are 720 ticks, like Taylor said, to represent 30 days. 30 days we determined to be long enough to see the infection throughout the transmission fully see the transmission, but not long enough to be too concerned with reinfection. So the 1 and 20 split. Our 1 individual that's infected can either be exposed, subclinical, or clinical, and our 20 individuals that are not infected can be maternally immune, susceptible, or recovered. So our model has a series of outputs that can either be recorded as 1 number per run or 1 number per tick per run, or in a whole run. So we have our final infected prevalence, our maximum infected prevalence, and our time of maximum infected prevalence, and a time series of infected prevalence. The final infected prevalence differs from our time series because our final infected prevalence we recorded solely as a number at the end of a run, whereas our time series we took the prevalence at every time tick in a run. So to visualize and understand our results, we coupled our simulation cases in 2s. So first we have our initially infected individual being either the most or least connected, and we compared in their t-tests and our time series of infected prevalence. And that was across the averages of maximum prevalence and the average time of prevalence and the average final prevalence for the 2-tailed t-tests. We did the same average comparisons for a heterogeneous or a homogeneous network. And Taylor will talk more about our results.
Stay over here. So these are the graphs of some of our results. We didn't include all of them because there's a lot of them. But this shows the maximum prevalence when you compare the cow that is most connected or most contacted with the cow that is least in contact with the others. And as you can see, the susceptible individuals here have a lot more prevalence of the disease. That's because they can actually initially contract the disease, where the other ones have to lose their immunity before they contract the disease. Here you can see the time it takes for those cows to contract the disease, and it's a lot higher in that maximum contact than the minimum contact because they take more time to develop the disease, and you have more time there to vaccinate your cows, to separate the individuals, and stuff like that. You can see the difference in here is because the minimally contacted cow, if you think about it, that one is minimally contacted, but the ones it transmits to and it infects are not necessarily the ones that are minimally contacted. Those cows might have a lot of contact, so later on the peak is a little bit later because of that. So here we have our graph comparing the heterogeneous and the homogeneous network. These networks, like Taylor said, were created to kind of show if the network is important and if the cow's social behavior is important that diurnally goes throughout the day, or if it's not important. But we did find statistical significance here with the stars that indicate the significance that there is a difference between the prevalence of the heterogeneous and homogeneous network. This is the time series graph of that data, and with the homogeneous network, we had a later onset of prevalence than the heterogeneous network. So it's just most likely because that all of them have the same number of contacts, and it takes longer because of the statistical significance for them to transmit is not necessarily as high every time. So these are our conclusions. Vivian's going to close us out.
Okay, so like from all the data sets we have, we came to the conclusion that changing the disease status of the initially infected individual changes the disease dynamics more than changing the disease status of the initially non-infected individuals. We also saw that there's a higher and faster prevalence of the disease with a heterogeneous network than a homogeneous network. And the heterogeneity in the individuals and in the network affects the cause of the disease. I mean, from that the farmers can like have an idea of the time to like vaccinate the susceptible individuals or possibly like isolate the infected individuals. For our acknowledgement, I mean, aside from our mentors, which are all great, we want to thank like Kelly Stoner, Toby Kuzman, Lou Gross, Eric Carr, and Mike Peak for all their support throughout the program. And yeah, do you have any questions?